India has achieved the milestone coverage of 75 crore vaccine doses being administered to people of the country. But how does it impact the public health measures in terms of the spread of COVID-19 in the country? To talk on that, we have Director of National Center for Disease Control, Dr. Sujeet Singh. Sir, thank you very much for taking our time. Sir, how do we interpret this 75 crore doses administration? How is it going to impact the spread of the virus that we are seeing in the country right now?
You have asked a very pertinent question, and I think we should look at this from two perspectives. Number one, 75 crore is a number for which every country and any country in the world can be proud of, and so are we. So this is a big number. We have achieved this. Number one. Number two, when it comes to having a correlation between the vaccination coverage and the public health measures, because vaccination is one of the important tools by which we develop immunity among the susceptible individuals. Second is the immunity through the exposure. Of course, vaccination related immunity which we are aiming is better than the exposure immunity. Number one, because it's a inactivated virus which we are developing immunity. So by this, when we develop the immunity, what we envisage is this particular immunity level will decrease the transmission among the susceptible population, and by decreasing the transmission, it will decrease the total infection load in the community, and that is what which we are aiming. We are aiming to reduce the transmission and also reducing the mortality and morbidity.
Dr. Singh, we are also seeing a significant coverage in Kerala. First dose has been given to 50% of the population, second dose has been given to nearly 20% of the population. But the case rise is still very high. Nearly 70% of the cases are coming from Kerala only. How do you interpret that?
No, I think we have to be very, very clear that vaccine efficacy is another aspect. Vaccine coverage is one aspect. We have covered 20% population by both the doses, means remaining 80% is still uncovered. Number two, of the 20% also, when we look at the vaccine efficacy, it is not 100% for any vaccine. So out of this 20% also, we have to take only 70%, which will in all likelihood develop the antibody level after this. So in this, what we have seen is that the 20% which we have developed is also spread across 14 districts of Kerala. So when you have spread out immunity, we will have to wait to see the impact of vaccination. But yes, definitely you can have a very satisfactory level where you can say that the vaccination coverage is far better than any other part of the country, and that will definitely give us a comfortable scenario. Case load is going to decrease there also, and what we have seen is that the first dose coverage is also giving us around 30% immunity. So by 30% from that, 70% from both the doses, definitely we will have a fairly good level, and by this at least we will be able to have a interruption in transmission.
My next question was that only. Sir, we are seeing Kerala cases coming down, but by when we can see that normalcy prevailing in the state, because festivals are approaching, there is a super spread event. It is being assumed that somewhere festivals are going to be a problem. When are we going to see situation improve in Kerala and also in the other parts of the southern country?
No, I think we have to look at from the two angles. Number one, the case load in Kerala of the new cases is going to decrease, and that will happen very soon. And I see another 15 to 20 days when we will definitely have a very decreased level of infection in this. But having said that, what I like to point out is we are approaching a festival season in all the states, and the surge in different states is at different times. So that we have to keep in mind. The surge which we have seen in the northern states was somewhere between 1st of May and 15th of May. We have seen in Delhi also, we have seen in many other states also. So from that part to this time, we have already crossed 3 months now. So it is more than 90 or 100 days. So after this time, there is always a risk when we will see that the exposure related immunity is going to come down. And similarly, when we don't have the appropriate coverage of vaccinated individuals also, so vaccinated individuals, exposure immunity, if both are going to come down, and if we will do laxity or complacency with the COVID appropriate behavior, with our festivals also. If we don't follow them properly, like if we are ourselves becoming complacent that okay, now nothing has happened for 3 months, let us be very relaxed, let us invite every friend, start having parties, start celebrating festivals, flocking the markets and so on and so forth without following the COVID appropriate behavior, then definitely we ourselves are inviting trouble for us. And that will definitely, because the infection is not gone anywhere, low level of infection is still there in the society, and that low level of immunity infection which is there, whenever it will get opportunity, whenever it will have susceptible individuals in the vicinity, which will be definitely encouraged by the super spreading event, definitely infection is going to rise.
Sir, by that means can we say that next 50 days are going to be very, very crucial because we have been talking so much about third wave and the festival seasons, mostly the crowding that we see during festival seasons are going to be crucial in the coming days?
I'll say yes or no. Yes is definitely, but in the current scenario it is. But as what we have seen in this pandemic, it is a very complex pandemic. All our estimates, whatever we may say, have been proven wrong. Why? Because there are many uncertainties. First uncertainty which I like to point out is the variant. There can be a different variant which can emerge and that can change all calculations. So that is another big uncertainty. Second uncertainty is regarding the immunity level. We really don't know exactly that at what level the protection prevails and whether all the population will have that level of immunity for a continuously long time or not. If whole population has fairly good level of immunity which gives us the protection prevails for 6 or 7 months, then definitely we will have a very, very comfortable scenario. But that is a big uncertainty what we are aiming. Similarly, how long this immunity due to vaccination will remain, and then whether the reinfection or whether it escape immune escape mechanism. So there are many uncertainties in this. But yes, of course, if we follow the COVID appropriate behavior very religiously and we are careful with the festivals also, we are able to track the variants in time, definitely we are going to have a good time in future.
So you track the INSACOG very closely. What is the mutant status right now? What are we tracking right now? What is the concern that we have right now? And is there a new variant prevailing in the population right now?
No, I'll again elaborate you. Variant of concern, we know VOCs which are there, which have been identified either in India or elsewhere in the world, are being tracked very closely and very meticulously. That is one. Second is variant of interest. Which variant of interest anywhere in the world, if a mutation is found which is there in that area of the virus where it can impact the transmission, like in the spike area or receptor binding domain area, and in that area if the mutation is there, we watch that closely whether that particular mutation is giving rise to high transmission or immune escape mechanism in the community or not. So genomic structure is one part, correlating it what happens in the community is another part. So we are tracking all such variants of interest also. Third is any new mutation like C1.2 which has been tracked in which has been detected in Africa. Similarly, MU mutation. These are the new mutations where scientists feel or the genomic experts feel that they could definitely impact the transmission. They could definitely have a more immune escape mechanism. So we are being made aware. We are also looking at what is happening across the world. Not only the INSACOG inside the country, but our genomic experts discuss this, and then when they find it suitable, they refer it to us, and from NCDC through IDSP, we monitor this particular variants in the community. As of now, these two variants are not there inside the country, number one. Number two, we are also tracking the variants or the sublineages of Delta Plus, which was initially called the AY series, which we are right now monitoring. We have seen a substantial rise in AY4 and AY12, but those we are tracking. But as of now, there is no cause of concern which we have seen in the community. So we can say that our tracking is going on as per our plan, and we are on the right track, and we are following the best of the scientific principles which are available or recommended by WHO or by any other experts in the world.
So the schools have opened and the vaccine for children is not there. The pediatric population, is it going to see increase in number of case rise, or the schools should be open for everyone? There is no concern that we have for children right now.
No, children are dear to us, so I'll not say that we should not have concern. We should definitely have concern, and more than what we have for us. So that is definitely everybody's cup of tea. But I like to elaborate here that whatever studies we have undertaken, we have seen in the seroprevalence study in Indore, we have also seen in elsewhere in the country, that children have also been exposed to an equal level as the adult population. Although we have tried, we have closed the schools, we have not been opening the schools for last 1.5 years. Children are suffering, that is, they are losing their what we can say, हम उनके बचपन को इतना नहीं दे पाए जो कि उनको स्कूल के वातावरण से मिलता है. तो मैं ये जरूर कहना चाहूँगा कि हमें सीरो प्रेवलेंस की स्टडीज़ के अनुसार स्कूल्स के खोलने के ऊपर विचार करना चाहिए, नंबर 1. नंबर 2, ये मान के नहीं चलना चाहिए कि स्कूल्स हमको कोई एक बड़ा वैसा सिनेरियो देंगे. So what I'll recommend is that as of now, we should not be looking at some kind of very serious scenario if we open the school. We have to take all the precautions. Guidelines have been developed in Delhi, guidelines have been developed in many states and internationally also available by WHO also. We should be following those guidelines. We should be taking all due precautions. But yes, we can, whenever the transmission is there, we should definitely open the schools, and we should also aim at taking all the due precautions with this.
Sir, if we exclude Kerala, we see the number of cases in country somewhere equal to that of the first wave, where we saw in January and February number coming to the to about 9,000, less than 10,000. Is it the right time to say that we are somewhere entering the phase of endemic in India? And by what time you're seeing that endemic phase coming to India?
No, I think right now it is too early to say this, that we are entering into endemic phase. We have to see the scenario which is there. We have seen 3 or 4 variants which have impacted the transmission across the globe. We have seen Delta Alpha variant in UK, we have seen Delta variant in India, and now in USA and UK also. So there is a lot of uncertainty in this. But yes, definitely RNA virus, there is a scene where we could have a very comfortable scenario. But by endemic, what I mean is we should be able to, it is no longer a public health problem. By that, what I mean is mortality and morbidity are under check. So that is what we are trying to aim at, and there should not be too much transmission which we should be aiming. So we have good strategies as of now. Number 1, COVID appropriate behavior, that will help us. Everybody now knows these strategies. Only point is that we have to follow them religiously. So again, I will like to mention, stress here very carefully. Number 1, vaccination. Number 2, COVID appropriate behavior. And this will definitely help us against all the variants. But still, it is maybe too early to say that we are entering into endemic phase. We will have to watch another 4-5 months to say that whether now new variants are appearing or new variants are being tracked properly, and no new variant of high consequence appears, and so on and so forth, I think.
Sir, nearly 11% of our population has been given, the eligible population has been given the Covaxin. What is the status of the emergency use licensure from the WHO? When can we expect that to happen?
No, I think Government of India has submitted the required scientific documents for Covaxin also. So very soon WHO should be giving us the certificate for that. So I don't think that there is any, whatever is required scientifically, Government of India is providing to WHO, and very soon we should be able to get that.
By this month end, or maybe next month?
Yes, I think by the end of this month, or maybe in the beginning of the next month, we should be able to get approval from the WHO.
So now when we are talking, even a team of yours is there in Firozabad. A question on dengue is also. What is the situation right now in Firozabad? So we are seeing those horrific images coming from the hospital, children dying due to dengue outbreak. What is the situation right now?
No, dengue is definitely there, but there are other vector-borne diseases also. But we have to look at it from a different angle. We have to see that once a vector-borne disease sets in, and you have a vector density prevailing in that area. The only way by which you can tackle is you have to reduce or you have to tackle all the vector breeding in that area. So once the vector density is tackled, definitely you will see decline in cases. But the other aspect is the treatment aspect. That depends on the health facilities and that depends on the larger health infrastructure which is available. So these are there. The dealing with the situation is twofold, and our basic task should be how to deal with the increased vector density. So there has been profuse vector breeding in that area that has been tackled by the National Vector-Borne Disease Control Program. So that is there in our campus only. So they are the ones who are responsible for this, and they are dealing with it effectively. And I think as soon as this vector density comes down, it takes time. Once the vector density is there in that area, adult and larval population, they require little time.
So one last question. We have seen two states, Kerala and Maharashtra, being worst affected. With the impending third wave, how do you see these two states performing? Because even if 7 districts in Maharashtra, somewhere in between, they were showing a bit rise, how concerning is Kerala and Maharashtra scenario right now?
Concerning, I don't see that because right now what we see is that 14 districts in Kerala were having more than 10% positivity for past 2 months. The positivity rose even to 17 or 18% or maybe around 20% also in some of the districts. So that positivity has given a fairly exposure in the community. We did see a very challenging scenario. But yes, definitely now the things are settling down, immunization is picking up. So that will definitely raise the seropositivity level and we should be able to have a declining scenario in Kerala. That is one. Second, yes, Maharashtra is a matter of concern as far as vaccination is concerned. But vaccination drive is also going on there also. I don't see that there is any specific reason for which I should be particularly looking at Maharashtra in a more different way. I think they are doing, both the states have got a very good health infrastructure also and good commitment also, healthcare workers, like elsewhere in the country. So what we are seeing is we are definitely going to have a declining scenario in these two states as well. But yes, I must give a warning also that the calming down of the situation in two states does not mean that we can take the situation on ride. We can go away with the complacency. We do not follow the COVID appropriate norms. So that should not happen, because still whatever we may say, still if the cases decline also, then also there is always a risk. Infection has not gone anywhere. Infection is still there. Even in our cities also, even in Delhi also, whatever transmission cases are coming means somewhere transmission is going on. So whenever transmission is there, definitely they will find susceptible population, and if the immunity level goes down, because these are the uncertain areas, immunity level, new variant, both the things can strike anywhere and everywhere. So we have to be particular about COVID appropriate behavior. That is 100% certain, and of course, yes, vaccination will give an edge to us also in this.
Thank you, Dr. Singh, for your time. With video journalist Dilip Ayushman for Mirror Now.